So hello everybody, and I hope you are all taking care of yourselves and as well as can be expected. Tara has been waiting to catch me at a not busy moment, which is a bit impossible at the moment. So what I'm going to do is involve you in what I'm doing so that I can take care of people as much as possible. And we're composing a blend of herbs that might be supportive for people should they have respiratory symptoms or have concerns. And I'm encouraging everybody to contact their GP or contact us here for personal intervention and assessment and triage. In the meantime, I'm looking through what we have in the stock cupboard, what's the current most available information on the contagibility, the kind of virus, the pattern that has been exhibited for previous epidemics, and seeing where we go from there. And the actions that I'm looking for in the herbs, and these are what I have taken from our stock room, are expectorants, demulcents, antimicrobial, antiviral, particularly looking for RNA viral antiviral effect, spasmolytics for the cough, and nervines, because I think we're all quite wound up and anxious at this stage. So they would be very welcome. Now, what I will do is I'll actually be looking for a nervine that's also a digestive and antiviral, and that leads us to the kind of information that I'm looking for, which is all my traditional textbooks here, which give me all of the constituents of the herbs that go through the botanical safety. So I'm cross-referencing all of these, but of course, by the time any book is a textbook, it's pretty much out of date. The fundamentals are very much the same because the constituents of the herbs haven't changed. But there may be more relevant or more recent research specifically, and the one that I'm particularly interested in here is lemon balm, Melissa officinalis, which has been shown to be effective, the essential oils from it, for avian flu virus, which is also an RNA one. So other herbs are for immune. I have andrographis here. We have Irish moss, which is very similar to our carrageen. So many of these are traditionally used for support. I also have elderflower, and elderflower has been shown to have antiviral influences, but it also strengthens the mucous membranes, and that would be whether it's for allergies or for any kind of respiratory virus. Lungwort, well, the name speaks for itself. This would be traditionally used for strengthening the lungs. And mentha pip. Mentha pip is peppermint, and along with the lemon balm, it's from the labiate family, all of which have proven antimicrobial effects. That's why we use thyme in our food to protect us, especially before we invented freezers or fridges. We have ginger. Along with the lemon balm, this is likely to help the digestion, and for quite a number of people there's a digestive element to this kind of being unwell. We have gumweed, which is very anti-mucus, thick mucus. It's good for shifting things, and of course what we want to do is to stay well and to shift, if we are unwell, to shift any of that thick mucus, because it only keeps us sick, because it's a lovely food medium for any bacteria or virus to grow on. I mentioned the thyme already, and a very nice nervine is the Verbena officinalis. Surprisingly, when I looked up the research, there has been proven anti-flu effect from dandelion root, which I never would have thought of. But I think there's quite a lot of inulin, but that's going on memory. So I'm never surprised by what herbs throw up. So if you are unwell, I can do a blend of herbs, either individualized or many of these will combine very well together, but I'll be choosing on a day-by-day basis and for each person as as we communicate with them. So I hope I'll be of help to as many people as possible over the coming weeks to months In the meantime, we have various tonics, which some of you might be aware of, which are the immune tonics, congestion tonics, and these are about being well and staying well as food supplements. But medically, we can take this to a little bit further on individual consultation, and always encouraging good food, plenty of hydration, getting tested so that we know exactly what the situation is. If you get short of breath, if you become very unwell, very important to get medical care, and keep washing your hands. And we will be swabbing down the computers and the camera. The phones are the things we're being very careful about. We will be seeing people with one person, two maximum in the clinic at a time, using all of the usual precautions. And we are still available on the phone, and we can courier blends out to you if you need anything for current support or for our usual herbal blends for you. Okay, so stay well everybody, and keep washing those hands, and keep your distance, and cough into your elbow.